Bursitis. A bursitis is an inflamed byssal sac. A byssal sac is a sac filled with fluid that acts to lubricate and reduce the friction between two surfaces in the body, usually muscles and tendons, as they glide over bony prominences. However, their purpose is not limited to just muscles and tendons. They may also be found in various pressure points in different parts of the body. What causes bursitis? In the foot, we have a unique situation in that between the shoes that we wear and the ground that we walk on, various parts of the foot are constantly being micro-traumatized, otherwise known as repetitive stress, meaning that every time we take a step we do a small amount of damage to a particular part of the foot, and eventually, that part of the foot begins to hurt. The body's response to this microtrauma is to create a byssal sac to initially protect, by cushioning, the area, but if microtraumatized enough the byssal sac itself becomes inflamed and we have a bursitis. Bursitis in the foot. Bursitis secondary to hammer toes. The top of the toes are so close to the irritating shoes that the constant rubbing of the toe on the shoe may form a byssal sac. Bursitis adjacent to a bunion, or Taylor's bunion. In fact, the true definition of a bunion is the enlargement of the metatarsal bone, deviation of the big toe towards the second toe, and the formation of a bursitis. Byssal sac on the back of the heel, between the Achilles tendon and back of the heel bone, that may become inflamed. Superficial byssal sac on the back of the heel. Many times there will develop a superficial area of mild redness, swelling and tenderness just off-center to the back of the heel. This is referred to as a pump bump. Due to the enlargement of the calcaneus, heel bone, on its posterior aspect, and the constant pressure of a shoe, usually a women's dress shoe, the body will form a byssal sac that eventually becomes inflamed. Ball of foot. A byssal sac may form on the bottom of forefoot simply from excessive pressure of walking or running. These are usually not visible because they are below the level of fat on the ball of the foot. Bottom of the heel. Unlike the bursitis we have already discussed, these are usually not visible because they are deep to the fat layer on the bottom of the heel. Treatment of bursitis. Conservative care. Modify your shoe selection, avoid wearing shoes that rub the painful area. Oral anti-inflammatory medication, short-term administration may be very helpful. Topical pain reliever. Over-the-counter pain relievers applied topically can be very helpful in reducing the pain. Icing the area during this period may also help reduce the symptoms. Orthopedic padding. Applying padding around the area will reduce the pressure directly on the inflamed spot. Orthotics. If the bursitis is occurring on the bottom of the foot, trying an over-the-counter arch support may help in an effort to redistribute body weight and take pressure off the painful area. Medical care. Draining the bursitis. If the byssal sac is very superficial we can usually drain the sac. Cortisone injections may be very helpful in reducing the pain of the byssal sac. Prescription medication. If over-the-counter medication does not work, then prescription medication including oral prednisone may be prescribed. Physical therapy, usually for the deeper type of bursitis. Surgical intervention. Correcting a bunion or fixing a hammer toe may be the only solution for some people to ultimately rid them of their pain. For a complete discussion of this topic, visit www.foot-pain-explained.com.